Hey everybody, in this lesson we are going to be talking about constipation and encopresis in our pediatric patients. So let's just start by covering some basic definitions. So constipation is when there's a change in stool patterns where it's becoming more infrequent, it's inconsistent, and it's difficult to pass stool. And usually a diagnosis of constipation, these problems have to have been present for 2 weeks or more to get that actual diagnosis. Encopresis is the involuntary passage of stool. So kids are having a bowel movement at socially unacceptable places and times. And the most common cause of this is chronic constipation. Kids with chronic constipation are likely to have fecal impactions, and this can lead to involuntary leaking of stool around that impaction. Now, one thing to note is that encopresis can also occur as a result of emotional stress and trauma. This is pretty rare, but it is usually the result of something severe. So it's important to be aware of that when we talk about child safety. Before we get into talking about some specifics for our nursing care, I want to take a couple of minutes to just highlight some common causes of constipation in kids. Some of these are unique to pediatrics, so it's just important to be aware that they can be the potential cause of this. So the first one is called Hirschsprung disease. Hirschsprung disease is when there are really important nerve cells missing in the colon. So these kids are not able to sense or know when they need to have a bowel movement, which leads to constipation. Next is any kind of spinal cord lesion, and this is because they're going to have, again, difficulty sensing when they need to go to the bathroom. An example of this that we see in kids is spina bifida. Cystic fibrosis is also a cause of constipation that we see in kids, and this is because CF causes a lot of issues with digestion and absorption of nutrients. There's going to be an increased amount of mucus in the stool, which can cause things to block up and just become constipated. We also see medications as a common cause in kids, and a lot of times we see this in kids who are on anti-epileptic medications, and this is especially true if this child is also bedbound and isn't able to be active and help keep those bowels moving. Really, though, what we see most often is called functional constipation, and another word for that is idiopathic constipation. And what I mean by this is just that no particular disease process can be found as the obvious cause. And usually with functional constipation, the primary causes are dietary, environmental, and psychosocial. And we're going to talk about those in more detail in just a second. So our nursing assessment of a kid with constipation really starts by just asking about the characteristics of the stool. And really a helpful tool to use when we are doing this is what you see here, and this is called the Bristol stool chart. So you can use that to help get information from parents. In addition to the characteristics of the stool, we really need to know how often they're going and if they're experiencing pain when they go. In addition to that, we really like to know if they're having any blood in the stool or if the parents have noticed any leaking, so that encopresis that we were talking about earlier. In addition to stool characteristics, parents are probably going to notice that they've had a decreased appetite, that they are just not interested in eating, and so we have to dive into that and get some more information. And then it's also important to find out what their diet is like, and we need to know about their toileting habits. For the diet, we need to know how much fiber they're getting and how much water they're drinking. And then regarding toilet habits, we need to know if there have been any changes to the routine. One of the most common things we see in kids regarding constipation is that when there's a change, they can start to have problems. So this is especially true for kids who are starting school because they're having a change in routine, and there may be some real anxiety about using public toilets and doing things a bit differently. For the newborn, you need to make sure that you assess for their first meconium. So meconium is that first stool that they have as a newborn, and it looks quite a bit different than the stools they'll have in the future, and it's black and kind of sticky. And if they don't have this first stool within the 24 hours, we call that a meconium ileus. And common causes of this are Hirschsprung disease that we talked about before, as well as cystic fibrosis. Treatment of constipation really depends on how severe it is. If the constipation has gotten so bad that the stool has become impacted, the child may need an enema. Otherwise, laxatives might be able to be used just on their own. Now, the most commonly used and accepted laxative for kids is polyethylene glycol, and this is because kids can actually mix it with any of their favorite drinks. So it can be mixed with water, it can be mixed with juice, and even soda if necessary. Once that constipation and discomfort has been relieved, it's very, very important for the kid and family to make dietary changes. So we're looking at increasing fiber, increasing fluids, and then remember, kids who are drinking too much cow's milk are prone to constipation, so we got to make sure that they aren't having too much of that in their diet. And then we need to help them address any bowel habits that may be contributing to that constipation. Most of the time, the most important thing to do is help break that pain and fear cycle that kids have developed during constipation. So kids who have pain when they go to the bathroom, they get scared of going, so they hold it in and they become even more constipated. So we've got to help them create a routine, get some laxatives on board, and help them learn that it doesn't have to be painful. A star chart is a really great way to come up with a schedule as well as give some positive reinforcement. Your priority nursing concepts when caring for a peds patient who's constipated are elimination, gastrointestinal and liver metabolism, and also human development, because it links in so much with what we know about toilet training. Okay, you guys, let's go through the key points for this lesson. So the first thing you've got to know is that constipation is a change in bowel function where you see a decrease in frequency, an increase in stool hardness, and you may even see some involuntary leaking of stool, where the medical term for this is encopresis. Most of the time, this constipation is caused by dietary and environmental issues, so things like lack of fiber, pain, and anxiety about toileting. So those are the important things to keep in mind for those dietary and environmental issues. And then we've also got to know that other potential causes are Hirschsprung disease, cystic fibrosis, and spina bifida. Our treatment of constipation is going to be all about enemas and laxatives at first to help reduce that pain and help them get rid of that stool. Then it's really important to increase fiber, increase fluids, and help establish healthy bowel habits. All right, you guys, that's it for our lesson on constipation in pediatric patients. Make sure you check out all the resources that we have attached to this lesson. Now go out and be your best self today, and happy nursing.